Let's all agree that 2020 sucked. It was a terrible tragedy that's ongoing here in 2021. We never want to do it again. So there are a lot of reasons why it happened. COVID, the disease, first off, political leadership is something we can point to. But there's also a problem underlying what we think about as preparedness. How we think about preparedness, how we do preparedness is wrong in a certain way. It's not about your household. It's not just about your government. In fact, the most important unit for preparedness is your neighborhood. So I want to talk about why that is and what you can do to make sure nothing like this ever happens again in your neighborhood. My name's Mitch, and this is Apocalypse Prep, the show that gets your people and your community ready for anything. So, you may not know this, but since 9/11, this country has spent more than $50 billion on health and medical preparedness. Not all of preparedness, not security, just the realm of health and medical preparedness. And it spent that money in very particular ways. More than $30 billion of that funding has gone to develop miracle drugs, to build infrastructure, to build national level capabilities, all of which are important. But consider this. In one 10-year period, the United States spent $16 billion on pharmaceutical research to discover new vaccinations, and only $100,000 researching how best to get those vaccines into people's arms. If you look at that imbalance, it shows you that the centralized ways that we think about preparedness maybe aren't the best. Maybe we're over-focusing on these big magic solutions and under-focusing on how we actually implement them in the real world. That shows up somewhere else too. There are now these big indices that measure preparedness around the world, that measure these systems and infrastructure that have been built up over time. The Global Health Security Index, the Trust for America's Health state rankings that come out every year, the National Health Security Preparedness Index. All of them look at census data, community survey data, but also indicators that are based on these preparedness capabilities. But here's the secret. None of them had any validity when looking at COVID death rates or case rates last year. None of them. If you analyze what they said about preparedness, it didn't mean anything. Famously, last February, President Trump said that we ranked number 1 on the Global Health Security Index. And that's true. We did. But still, our COVID outcomes ended up being among the worst in the world. When you look at that, you have to say there is something wrong with how we are thinking about preparedness. So what is it? What's so wrong? To answer that, we have to look first at what is meaningful. If these preparedness indices weren't meaningful, was anything meaningful in terms of how neighborhoods, how communities would deal with COVID? And it turns out, yes, something was meaningful. What was it? Social capital. How well neighborhoods stick together. There's an amazing paper that just came out that was by Timothy Frazier, Daniel Aldrich, Courtney Tan, that looked all across the country at census tract level COVID rates compared to various measurements of social capital. And what they found was that measuring social capital was more than 90% predictive of how well a community would do for COVID. So what is social capital and what does it mean? Okay. Well, when you say social capital, there are actually 3 things that researchers are talking about: bonding capital, bridging capital, and linking capital. So you can bond, you can bridge, you can link. When you bond, you're talking about your close friends and family. You think of a pod or a family group, that group of people that is really supporting each other to get through the tough times. So it builds trust, between those friends and family members. That's one. Bridging, when you bridge, you are connecting between those networks. You are connecting your group of family and friends to another one. So that might be through sports, through a church, through a civic association, through a civil rights organization or a club or volunteering. All of these things bridge these groups of bonded family and friends with each other. And bridging is really at the root of our society. The paper calls it fundamental to our democracy because it's through bridging that we kind of build these coalitions of meaning with each other, right? That's how we build tribes into societies. It's through bridging. And finally, we want to look at linking. What does it mean to link? So when you link, you're connecting your friends and family, your civic associations and other bridged networks with your government, your representatives. Are you well linked to those folks in power? Do you feel trust in those? Do you feel represented by those folks in power, your city council, your state representatives, your national representatives? So you bond, you have friends and family together, you bridge, you connect with other networks through associations, through clubs, through churches, through work, whatever it is, and then you link. You connect these kind of horizontal ties vertically up to your governmental representatives and leaders. So all three of these kinds of social capitals mean slightly different things in terms of preparedness, but they're all important in getting your community ready. Let's talk about links first. That's the cleanest. The more linking capital a community is, the more trust that community has in its government. The more trust it has in its government, by and large, the fewer COVID cases it had. Really simple. The more linked you are, the less COVID. It's highly predictive because trust in government generally means that people are going to follow mask mandates. They're going to listen to public health guidance, and that work keeps people safe. We have that with great evidence at that time. So that's linking capital. So let's talk about bonding. Bonding, by and large, also reduces COVID rates across communities. Now, that's because when you have high trust between friends and family, people stick up for each other. They take care of each other. They reinforce making sure everybody's wearing masks. They reinforce social distancing. They help with mutual aid. They help somebody out financially. They deliver food. All that stuff helps keep people safe and well during COVID. But there's a catch. Some groups are so bonded that they become insular. They don't want to listen to anybody else. They become so tribal that they won't let any outside information in. When those things happen, when those groups get together, we start to actually see negative impacts of bonding. Because you're so bonded, you're not going to listen to anybody outside your tribe. We saw that in New York City among the Orthodox Jewish community. We've seen it in a lot of more rural right-wing communities that are dominated by right-wing media that's anti-mask based, and those things have a real impact. That's where bridging social capital comes into play. Bridging is one way to get to cross that boundary, to make sure that these groups that are really bonded together are listening to other folks. So even if you're in a tightly knit community, if you are bridging with other communities, you're getting new information in. Bridging ties aid most communities because it fosters trust and reciprocity, pro-social behavior across these lines of race and class and religion and politics. We need that bridging for things to go well. Now, there's kind of a catch here, too, which is that COVID is unique in that those bridging ties sometimes became super spreader events early in the pandemic, right? You got everybody together in a church, you got everybody together at a job site, and those things triggered epidemic spread because of the nature of the pandemic. So it's a twofer. You need bridging because that is where innovation happens in a pandemic. When you hear about these mutual aid societies that people have had, or people who work together making masks together, or people who belong to a religious association together delivering food together, that's bridging at work. These people are connecting with each other, and that bridge is giving them power to improvise and to go out and do good in the world across lines of race and class and politics. That is so important. But in a pandemic, we've got to watch it because you just don't want to get big groups together from different pockets of folks. So you bridge, you bond, you link. Linking, always associated with fewer COVID rates. Bonding, you want to be close, you want to support your friends and family, but you don't want to be so close that you don't listen to anybody else. Bridging, really important to adapt, to improvise, to connect, to build democracy, but you don't want to get them together. You don't want to bridge to create a super spreader event by getting lots of people from all over together at one time. Those are the important lessons that you want to learn in the pandemic. Now, there's kind of a secret at the heart of this, which is something that I call the Staten Island effect, from a really classic anecdote that's sort of there in the paper. So why is it the Staten Island effect? Well, here's the thing about Staten Island. Staten Island is home to about 5% of New York City's population. But towards the end of 2020, it was a quarter of COVID-19 fatalities, right? Small number of people, many more fatalities than there should have been. Now, why is that? Well, the borough had low resident participation in public health measures. People didn't wear masks. People didn't abide by indoor restrictions on indoor dining. People were exercising together, all kinds of things. People in Staten Island were basically pretending the pandemic wasn't happening. But Staten Island has really high levels of bonding, bridging, and linking social capital. It's an outlier. And it presents an important paradox for preparedness, which is that if everyone you're connected to, the folks you're bonded with, the other associations you're bridged and connected to, along with your government representatives, are all believing misinformation, the protective benefits of those linkages aren't going to help you. If I live in Staten Island, I'm talking to my friends and family. They're telling me the pandemic's not a thing. I'm talking to my civic associations. I'm talking to my folks I work with. They're telling me the pandemic's not a thing. I'm talking to my representatives on the city council, my state and national representatives in Congress. They're telling me the pandemic's not a thing. Well, the pandemic's not a thing. The only problem is my fatality rates are 5 times higher than they should be. These things, bonding, bridging, linking, are capable of great good. But if misinformation takes over all of them, then you're a little screwed, right? Then there becomes less and less you can do to help the impacts of the disaster in your neighborhood. So let's talk about what I want you to do to help your neighborhood. And it's pretty easy. It's pretty clear. I want you to bond. I want you to hold your friends and family close, talk to them about difficult issues, make sure they understand what's going on, make sure together you have a plan to get through the next weeks and months for this or any other disaster. I want you to bridge. I want to make sure you're joining civic associations, you're talking to people that you work with, you're joining churches, you're volunteering, because that bridging makes democracy function. Our society can't work without it. And I want you to link. I want you personally to connect with your representatives. Call your city council person. Build a relationship with your state representative. Build a relationship with your county commissioner, because those linkages are going to pay off at times of disaster. These connections, for better and for worse, showed more than 90% of the variance in COVID rates after you control for things like underlying vulnerability and mobility, that kind of stuff. They were much more predictive than any of the things we think about as preparedness. So build them in your community. They will keep you safer. These connections matter so much more than, at the end of the day, things like a go kit or 4 gallons of water, or making sure that you've got a working crossbow in your basement. They matter because they connect us with other people. So I want you to go out and make those connections and use them to keep your family safe. Thanks for joining me today.